Hi guys, welcome to this series where I'll be discussing some tricky MCQs with all of you. The questions have been posted already on my Telegram channel a week ago, and now we're going to do the solution for it. So let's begin with our first question where we are going to discuss about a patient who's undergone parotidectomy, and after parotidectomy the patient is complaining to you of having a numbness while shaving. That's the very important keyword given to you, that the patient is having numbness while shaving in this area. So which nerve is most likely injured? So we know that parotid incision goes below the ear and it is a lazy S incision. So whenever we do the incision and dissection below the ear, the nerve supply of the lower part of the ear is via the greater auricular nerve. And now there is a possibility that while you were doing your parotidectomy, you might have cut the greater auricular nerve, resulting in numbness in the shaving area. So the correct answer for this question is going to be the greater auricular nerve. Let's go to the second one where it says that a patient was administered cold water in the right ear and the nystagmus was seen to the left. So where was the cold water given? In the right ear. And where was the nystagmus seen? To the left. So what is the correct interpretation of the test is given? So we know a simple rule for caloric test, which is cows. Cold water will cause nystagmus towards the opposite side and warm water will cause nystagmus towards the same side, which is cows. So when we talk about cows, cold water to the opposite side and warm water to the same side, here we are seeing a response which is similar, which is cold water in the right ear is causing nystagmus towards the left ear, which means that the fast component of the nystagmus is towards the left. And whenever we have a fast component of the nystagmus towards the opposite side, we mean that there is a hyperactive labyrinth on the deceased side. So is the deceased side right side? Yes. So is the deceased left? No. Is the slow component to the left? Whenever we talk of the direction of nystagmus, we talk of the fast component. So it is not the slow component to the left, it is the fast component towards the left. Direction of nystagmus is to the right? No, direction of nystagmus is towards the left side, which is clearly given in your question. So the answer is option 1. Let's go to the next question, which is for crocodile tears to occur, injury should be where? So we know that the first genu of the facial nerve gives a branch which is called as the greater superficial petrosal nerve. So whenever there is an injury to the nerve beyond the GSPN, there can be faulty reinnervation of the fibers of the facial nerve with the GSPN to cause gustatory lacrimation. So this we call it as crocodile tears, and this occurs whenever there is an injury beyond the greater superficial petrosal nerve. Next, we have got a question where a patient has got vertigo, which is intractable. So they're telling to you that the patient is having severe intractable vertigo, and this vertigo is not having relief, and the patient is having complete sensory neural hearing loss. So whenever a patient has sensory neural hearing loss, which is complete, it means that the cochlea is no longer functional. And if the patient has an associated vertigo, you can destroy the labyrinth completely so that whatever the symptom is there of vertigo disappears. Anyways, labyrinthectomy adverse effect is hearing loss. But since the patient has pre-existing hearing loss, we can go ahead and do without any fear a labyrinthectomy. So the correct answer for this question will be to do a labyrinthectomy. Why not the other options? Endolymphatic sac decompression, vestibular neurectomy, sacculotomy, all of them can be done. But as we do this surgery, we see that they're very close to the brain and the brainstem, and we do not want to cause damage. We want to be as conservative as possible during surgery. And since the patient has already a SNHL, we are not worried of labyrinthectomy side effect, which is SNHL, and hence we would go ahead with labyrinthectomy. The next question is a pretty simple question, which is tongue muscles are derived from where? We know that the tongue muscles are derived from the occipital somites or the occipital myotomes. So that has to be your right answer. The next question is on the N3 staging of a TNM in head and neck malignancy. So whenever we talk of head and neck malignancy, N0 means there is no lymph nodes. Okay, so there is no lymphadenopathy. N1 would mean that there is a lymph node which is less than 3 centimeters in maximum diameter. N2 is if it is between 3 to 6 centimeters in the maximum diameter, and N3 is if it is more than 6 centimeters in the maximum diameter. So here the question is on N3. So what should you think of? First thing, look, is wherever you get more than 6 centimeter, that has to be the answer. So option A is 3 to 6 cannot be, 3 to 6 cannot be, 3 to 6 cannot be. So the correct answer is option C. It could be ipsilateral or contralateral nodes. If they are more than 6, then only you will see that it is N3. So that's the right answer. The next question is on a patient who's come to the emergency department after being struck by a motor vehicle, and the patient is noted to have blood coming out from the mouth and the nostril, and the jaw is noted to be rigid, which means that if you have to secure the airway, you cannot intubate the patient because from the nose there is bleeding, you can't pass the tube, jaw is rigid, you can't pass the tube, and from the mouth there is blood, you can't pass the tube. So what is the next step that you do when you cannot intubate? So when there is a situation where you cannot intubate, the next step that you will do will be to go ahead for a cricothyrotomy. So for a cricothyrotomy, what is the most important landmark that we assess? It is the laryngeal prominence or the Adam's apple, which we see. That is the prominence. You just keep palpating it in the midline and go downwards until you feel loss of resistance. So where you feel loss of resistance, that is the area where you have the cricothyroid membrane and you're going to make a puncture in it. So now to do a cricothyrotomy, the landmark is the laryngeal prominence. Now, anterior triangle of neck is a vague landmark. It is okay. We do cricothyrotomy in anterior triangle, but is it a specific landmark? No. The angle of Louis is your suprasternal notch. Again, it's a very vague landmark. We can't say 2 centimeter, 3 centimeter, one finger, two finger. It is not a appropriate landmark. So that can't be the answer. Xiphoid process is much downward. So that is not the landmark. The correct answer is laryngeal prominence. We have a next question where a 6-year-old child's mother comes to you claiming that his voice has changed and the child has fever and the sister also had flu. You notice that the child is having stridor. What is true regarding the management of this patient? So, what are we talking here? Whenever we see a 6-year fever, the other sibling is also having fever, and the child is having stridor, the first thing that we think of is acute epiglottitis. In younger age group, you can think of croup, but here we are going to think of acute epiglottitis. So, in acute epiglottitis, what is true regarding the management of this patient? A thorough ENT examination is not required, including inspection of the throat is absolutely true because whenever you try to do that, the patient can go to laryngospasm. So you avoid that. The child should be sent home and the mother given advice for paracetamol administration is false because it's an emergency. When a patient comes to you in stridor, you can't send the child back home. Antibiotics are definitely needed. This is wrong. Antibiotics are not needed is false. And if you make the child to cry, the child should be made to cry is false because if you make the child to cry, the child will have further worsening of the airway and stridor will only increase. And hence the correct answer is thorough ENT examination is not required. Next, we have a question that asks to you about how to calculate the appropriate internal diameter of a tracheostomy tube. This is very simple. It is age in years by 3 plus 3.5, and this has to be your answer. Next, we have a question where we have a 3-year-old child who's diagnosed to have a bilateral moderate SNHL. Whenever there is a question on moderate, what will you do? Whenever there is a moderate hearing loss, what we do is a hearing aid. We rehabilitate the child with a hearing aid. But if the same question would have been on severe or profound hearing loss, then we would have thought of cochlear implant. But since the question mentions to you about moderate hearing loss, the answer has to be hearing aid. So with this, we finish our 10 questions. One or two were simple, but most others I tried to put a little trick into it each time. I hope you did not fall for the trap and you were able to get your answers right. I'll see you all again in my next episode of Tricky Series 4. Until then, take care and bye-bye. And if you have any questions, please do leave it in the comment section below and I will answer back that to you. Take care and bye-bye.